Diana are both on.
All right, good morning.
Everyone.
Oh, is there an echo?
That was great.
Oh,
Say
you're good,
morning.
okay. Oh, all
Can
right.
you hear me well? I just want to make sure you can hear me well. All right,
Oh.
thank you.
Yep, you're good to go, Brandon. And Ann, can you hear us? You all good?
Yes.
Okay, thank you. All right, I'm gonna call this meeting to order. A review of the agenda. And then does anybody have any, or can I get a motion to approve the September 8 meeting minutes?
I so move.
Is there a second? So Brandon second. All those in favor say aye.
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 Hi.
All right, thank you very much. Anybody signed up for public comment?
That's Steve Bro, the lawyer.
Yeah.
Good.
All right,
Who do we have on besides Brandon and Ann?
we've also got from an official standpoint, you've got Nathan and Steve Crow,
Caleb's from this.
Both?
Jefferson.
Spirit Jefferson.
Oh, okay, is that Tim Cook?
It's one of their other reporters.
Yeah.
Okay,
Caleb is his name.
okay.
All right. So if no public comment, then we will start with unfinished business.
So just quickly on that sanitarian vacancy, we've published it and it's out there, so.
Got it.
See what happens.
All right.
And the,
So I can talk about some other, some others. I was going to say that for my health administrator report, Dr. Reedy had suggested that we do that. And I think that seems the appropriate time to talk about like position openings and things
Sure.
like that.
because we
always have that under.
we
unfinished
actually have
business.
several other
Yeah.
positions that are open, but it.
So quickly, the Division of Personnel just gave us an allocation for a peer recovery support specialist or a peer coach.
Okay.
So that is now an official position in our local health department.
Oh, okay,
We're
so
one
the
of only,
lady,
like
the
7
lady
counties
that
have
was,
that.
the lady that was here a
Yes.
couple
Yes.
meetings
We
ago.
have her as a temporary
she's
employee right now.
official.
Yeah, we have to put it out for public application. So
So is it her?
she'll be one of the applicants.
I
I'm sure.
see. Okay.
Yeah, before we weren't officially approved to have them as a full-time employee.
Right, that position.
And so that only took you 2 months.
Only 2 months.
Actually not bad.
That's not that
It's
bad for
actually not
government.
bad.
No, it's not that bad for government. So we're also still working to try to find a social worker that fits into our plans. And then, of course, we had a resignation at the front desk and we've been interviewing this week for that position and think we'll find somebody in the group that we've interviewed. We've had 2 really strong candidates so far. I think we're going to have 2 or 3 more strong candidates. So might be tough. It's good to have it. Good for that to be difficult, actually, to decide which good people you get to bring in. So
Very good.
that's it.
All right, we'll move on to new business.
Thanks, Good morning, everyone.
Good
So
morning.
you have the August 2023 financial report. Bank balance as of 8/31/2023, $602,000 in excess of reserve requirements by $246,000.
Sorry, what was the number? Oh, wait.
$602,000, almost $603,000.
Got it, thank you.
Financial summary, so if we just look at August alone, revenue of almost $67,000, we're going to reduce that by salaries and wages of $118,000 and operating expenses of $8,800, giving us a deficit for the month of August of $60,000. Fiscal year to date, so this is July and August. Revenue $205,000. We're gonna reduce that by salaries and wages of $206,000 and operating expenses of $30,000, leaving us a deficit for July and August, $31,000. If we're gonna compare this to our budget, revenue is below budget by 3%. Salaries and wages are more than what we budgeted by 2%. And operating expenses are below what we budgeted by 5%.
I have a question. So
Absolutely.
what makes the obviously the revenue, I understand that kind of variation fluctuation.
Mhm.
But there seems to have been a sharp uptick in the salaries and wages for August. And there's a yang on the operating expenses, so that's what accounts for that?
Yeah, so one of the items in the salaries and wages, so we also have employee benefits in there. And there's an extra health insurance payment for the month. So there were two instead of one. So
So
that's,
it's like a quarterly thing that kind of, or is it just some kind of timing issue?
It was a timing issue based upon the fact that I was told by PEIA that they hadn't received payment.
Okay.
So I paid it again just to be absolutely sure. Then they processed the original payment. Then they processed the second payment.
Okay.
So we had
So you're
prepaid,
ahead now.
we
So now we
prepaid
have
for
a
the month
credit.
of September, yes.
Okay.
But we had all received, that's a heartbreaking thing when you receive in the mail, your
Oh, yeah.
insurance is going to be canceled if your organization does not pay. And so I paid it again, because I got the letter, Dr. Reedy got the letter, I think a few other employees got the letter, Mason got the letter.
I've had that happen.
So I just went in and I paid it again, I was like, we have the money, let's just pay it again, and when it processes
Yeah.
through, we'll get a credit, and so we have a credit for September.
Excellent. We'll see a corresponding.
Write a little inverse on that.
Yeah,
It's in
okay.
September.
All right, so I'll look forward to that.
okay.
Well, we have that coming.
Accounts receivable, $233,000. 76% of that is related to West Virginia Treasury, total $176,600. That makes up $75,000 of the ELC grant, $28K prep, and about $20,000 of the racial disparities. There are some other items in there, but those were the major items we're waiting for the state of West Virginia for. If we're on look at this year compared to last year, the last page of your packet. Deficit as of August 2022 was about $20,000. Our deficit right now is almost $31,000. So a little bit behind where we were last year
Through August.
through August, yes.
But still with 232,000 in accounts receivable outstanding.
Plus, we have a credit.
Plus we have about a
balance.
About a $7,000 credit.
Yeah, so that's a big chunk of it right there.
Yeah, it's just
That will be the financial statements.
Oh, it happened.
August made me nervous. September.
Yeah.
And October's much
Those are
better.
financial statement adjustments. Yep, no, that's a really.
But you've been doing this long enough, you know that. Oh, absolutely.
Welcome to government.
It goes up and down.
I like them.
Private sector is no different, really.
Yeah, private sector too, same.
Yeah.
I believe that concludes the August 2023 report.
All right, do we have a motion to accept?
So move.
Second,
You know, any discussion? All those in favor say aye. Aye.
Aye.
Thank you, it passes.
September preliminary. Or 25% through the year.
Scary thought.
Bank balance $554,000 in excess of reserve requirements by $207,000. In September. For the month of September, revenue $124,000. We're gonna use that by salaries and wages of $95,000 and operating expenses of $11,000. Leaving us a surplus for the month of September of $18,000.
Oh, okay, sorry, I just realized that says August, but.
Yep,
it
I'm
says
sorry,
September.
yes, it does.
I was like, those numbers are different.
For the.
That's okay,
final-
it's September.
Yep, it is September,
Right.
and I will revise that for the final report. next month. Fiscal year to
Good catch.
date, so July through September, revenue $329,000. We're gonna reduce that by salaries and wages of $301,000 and operating expenses of $41,000, leaving us a deficit of $12,700.
Which is shrinking.
Yes.
Mhm.
If we compare this to the budget, revenue 3% below what we budgeted. Salaries and wages above what we budgeted, more than what we budgeted by $2,000, or sorry, 2%. And operating expenses less than what we budgeted by 10%.
So with the wages being above what we budgeted, what's that, where's that, how's that happening? Cause that's now,
That's increased staffing,
okay,
based around the opioid, the OBMAT and the quick response team. So
okay,
that's increased, that's going to increase our salaries. That is all 100% paid for by the West Virginia State Grant for the QRT
got
program.
it, okay.
After we incur the expenses,
I
it's
see.
it's reimbursable, it's reimbursed. It's not a here's your money, you spend it down. It's a spend the money, we'll replace it.
Send us the
type
bill.
situations, yes.
Quarterly
Billing.
and then a delay till. it
And then-
comes.
Quickly, we'll talk about the QRT. We will report on the financials based upon when I file for the grant reimbursement, because that'll be the hard numbers. And then I can say, yes, this is the amount, and this has been filed for, it's been sent for reimbursement.
And are you able to process that reimbursement? What, do you need our approval for
Not
that?
at all.
You can just send in
Just
the
a regular grant.
Okay,
Yep.
got it.
Accounts receivable. Balance as of September 30th, $312,000. $257,000 is related to the state of West Virginia, so that's 83% of the accounts receivable balance. That's a Q2 fiscal year 24 allocation. The ELC grant is still in there, and so is the racial disparities grant. If we compare where we are right now, for the September 30th of 2023 to 2022. Right now, we're at a almost $13,000 deficit. Last year, at this time, we were at a $21,000 deficit. So we're making up some ground. Any questions on the September preliminary statements?
All right. Thank you so much.
More than welcome. Thanks for having us today.
Great work as
Thank you.
always.
Thank you.
All right, agency reports.
So no Gillian today. She is out, not feeling well. To be honest with you, there was nothing dramatically unusual about this particular environmental report for the environmental health side. They're continuing to push through. They're also catching up on a lot of the uninspected restaurants that haven't received any inspections in the last few years. I actually had somebody come to me and said, hey, they finally came by today. And I was like, all right, that is awesome. How would they treat you? And he said they treated us wonderfully and worked with us for the things that needed to be corrected. So I thought that was great. Other than that, nothing fancy on the environmental side.
Okay.
I was gonna say nothing crazy for that part either, so I went to a conference, well, with Gillian and the sanitarian staff, and we did a radiation workshop and exercise, which was fun. It was just, we
That's
did
why I
all
love
the, we
Mason.
did all the training for
He
it.
likes that.
We got to try out a lot of the equipment for it and stuff that the Monongalia Health Department has, county health department, because
Because they're big.
yeah, because they're big, and they have a really nice tent set up to do decontamination if there was like ever an incident, like a hazmat incident that required it. And so that's really everything that happened for September.
Okay.
for me, so.
Is there any, anything from a community standpoint, threat levels with everything that's going on? Like obviously DC right now is under,
Yeah,
High alert.
I've really been like paying close attention to that there. I mean, there's always an inherent risk of stuff like that, but obviously with things escalating over there, it's definitely something that we want to keep an eye on. And so from an emergency management perspective, we have access to the West Virginia State Fusion Center. And so I recommend that you get the app, and I can reach out to the guys at the emergency management office to get you access to that if you want. But if you see anything sort of suspicious, you can report it into the Fusion Center, and then they can take a look and see if that matches up with something else that's going around the country. So It's,
Yeah, that'd
it's
be
nice
cool.
to have, because
Yeah.
you can monitor trends for, drugs and crime and stuff like that.
Great.
See if there's patterns with it.
Yeah, I'd love to have the app information.
Yeah, the rest of the state and their threat prep is always looking at homegrown stuff. Which of course affects us also, but we are especially vulnerable too.
Right.
Um,
If we see lots of black
outside.
sedans and Suburbans running through on 7, just start heading west.
Go the other way.
At least one
Follow
of
them.
one of the highways is already blocked.
Yeah, exactly.
Move in the opposite direction of whatever might be glowing.
Right.
Want me to take care of the clinical work real quick, or do you want to just discuss it, Dr. Eady? It's up to you.
So the clinical report was nothing out of the ordinary. The vaccines are continuing. A lot of kids still hadn't gotten their school vaccines. They're keeping busy catching up on that, and we do now have we're giving out a fair number of influenza vaccines. We have the RSV vaccine in. So mostly medical practices don't have that. Same with the shingles vaccine. Those are targeted for older people, and so Medicare is the main payer, and Medicare pays that through Part D, which is the pharmacy prescription drug benefit, not the B, which is usual vaccines, which means most offices don't get it because they won't get reimbursed. You can get them through a third party that then it doesn't do money laundering, but it allows you then to be billing on that behalf. And so we've been doing that, and the RSV vaccine is the same. So the staff just, okay, we'll do that process so that so it's
we get paid.
available. The COVID vaccine, we hope we'll be getting that next week. Getting it through the manufacturers turned out to be difficult, but getting it through other distributors, including our regular medical supplies like gloves and all that, it turns out that we can also get it through there, and it'll be timely. So the whole logistics issue is knowing your science isn't good, knowing how to make vaccines isn't good enough. You got to know how
Gotta be
to
able to deliver.
get it to the people tomorrow.
So
And they're grocers and everyone else knows how to do it, but it's the pharmacy business is, we're very dependent on that.
this report, though, on the clinical side continues to show the demand that we've been able to build over the last few years. We're much busier now than we were 2 years ago. We're billing out a lot more, seeing a lot more patients, whether it's for BCCSP, the breast and cervical cancer screening, or family planning, or any of those other types of things that we provide, services that we provide. The numbers have increased dramatically over the last 2 years, and seeing a full appointment book is always a little intimidating in the morning when the nurses come in, but they've gotten used to it.
Well, does that reflect that people don't have their own doctors?
There's some of that, but there's also services that we provide that you won't find at certain doctors' offices, and Dr. Breedy can speak to that. That's some of the things that we offer, not as easily gotten at private medical offices.
No.
And compared to a year ago, it's hard to think back that far, but a year ago, we were uncertain about our nursing staffing issue. We were, down to one. And we're much more solid now, and that reflects in their planning for we're doing reminder texts and just all these little pieces that have to, but they, people coming in, it's like, oh yeah, you reminded me to come in.
Yeah, no shows.
They have to do it for me when I'm.
It works for me.
No shows were a real problem for a while, and we've thought about it and said, hey, well, what are we not doing that other offices do that make sure people come in? Reminder calls.
Right.
So we use the automatic system, and it just takes care of the force now. No shows have gone down significantly. That's anecdotal again. That's what we see. I don't have any data around that, but the front desk can see it, and they'll come and say, hey, a lot less no shows now.
Right.
And just the attitude of, we can help serve you instead of,
Yep.
well, call back next week.
Right.
That's gone.
Wait lists for things we don't have yet. And so.
With the TB skin test, what is that just increased incidence, or is it just because there's certain things that people need TB tests for before they can travel or whatever?
Right, for certain employments,
Employment,
stuff like that, and, the, so that can fluctuate some, but it's. Years ago, it used to be a whole lot more because. Lots of like school kids had to have it and stuff like that, but that's not, hopefully we don't get to have high enough instances that we're needing to test.
Yeah, that'd be nice. Hopefully we don't ever get to that.
I mean, any questions? All right, we'll move on to epidemiology.
Alright, so continuing with the trend that's already happening, nothing really significant happening over here. As of right now, there hasn't been a significant increase in any respiratory viruses observed. Hospitalizations continue to be low, and we are expecting an increase in both influenza and RSV due to them being seasonal, but that's on trend with the past. Looking at the reportable diseases within Jefferson County, enteric diseases are the most common thing I'm seeing right now. These
What
are
diseases?
enteric diseases,
Define that.
in there.
Oh, sorry.
These are bacterial, parasitic, and viral diseases that are tend to be linked to food and waterborne illness. Enteric diseases cause an estimate of 48 million cases and 40,000 deaths each year in the US, so they happen pretty often, unfortunately. These aren't always linked to food and water though, that's just one of the main sources. Most cases of food-borne illness can be prevented with proper storage, cooking, and processing of food, destroy pathogens, and careful attention to hand washing and preventing cross-contamination. Gotta throw my helpful tip.
Wash your hands.
Yeah.
So, also, if you have farm animals,
Yes.
there are different, organisms you can get from them, that, that stuff is dirty, there are things you can get.
Don't hug your chickens.
It doesn't matter if you've got,
Don't let them free roam your
Just-
house.
doesn't matter if you have one or
Just get rid of
5,000. It's,
Right.
all you need is one with an infection.
I'm on Facebook pages for chicken owners. You have chickens now, right?
Yes.
It's like people are like hugging their chickens. I'm like, I'd stop doing that.
Don't even get me started.
Amazing.
They're really very sweet birds.
They really are. Yeah, a lot of personality,
Yeah.
but don't hug them.
My thing is just don't let them free range in your house, like
Right.
outside.
Right. I don't even want them on my deck.
Yeah, it's probably safer that way.
Yeah,
They are sweet.
all right, health officer report.
So we can continue to work on building the opioid response program with the quick response team. Actually, their staff is out right now, seeing someone who's had a recent overdose. They've had several calls this week, built their relationship with their counterpart at the emergency department in Jefferson. So these are, we're in our infancy of this program, but it's building, and we recruit the other person, and then the opioid, medically assisted substance that we talked about, that's in the process of the bureaucracy. First, we have to get the Office of Facilities Management has to approve our request that we don't have to have a certificate of need. We're not building a new hospital. That has to be done. And then they say, yes, you can just go ahead and do that. And then we submit the form. But when we submit the form, they may come and inspect us within a week or two. For our registration is what it's called. It's not even a license.
So this is strictly on opioid.
This
This is
is
for treating for substance use
Right.
disorder with medicine.
I see.
And
Okay.
so we won't be doing general behavioral health services like children with mental health problems or demented older people with people with bad schizophrenia. It's only if they have substance use. Now, what else they bring with that, we will address that. But if we were going to be doing other things, then we would have to apply for behavioral health license for the state And that's much more involved. It's, but we will have to. We've got some verbal that no, we won't need that, but it's not yet in writing saying you don't need it.
So going
there's
back to the
steps.
certificate of need, though, so are you saying? You have to put in an application or whatever to clear it, or are you getting to our Board of Health kind of exempt from certificate of need in this space?
So the whole program issue isn't, it should be that they say, oh, no, you don't need it. Like if someone called us and said, we need to know if we need a license for this, we'd say, no, you don't need a license, or you need to call this other, this is. So there's certain geothermal wells that people get, they say, do we get involved? And depending on what's involved, it may be the state agency that does it instead of us. But we don't require them to fill out the forms for us to say, oh, no, not to us. But that's not what's happening here. It's just, so we just go through the steps. It's frustrating, and these are obstacles that from the federal government standpoint, they would like this to be available by any private practitioner that wants to prescribe this for someone, just like you do for, treating pneumonia or anything else. They changed that law this past winter. But our state has all these other things to make it more restrictive. Now that hopefully will change, because this is an issue in the state. And across the nation, it's an issue, but especially here. Most private offices are not going to go through the bureaucracy of trying to get specially registered for this and there's all this list of policies you have to have, including one of them is a social media policy for substance use disorders, like meaning what can our staff be putting out on social media but it's like regular doctor's office says, I'm not developing 40 new policies. But it is what it is, and it's frustrating work. Because you don't feel good when you finish the applications. How it feels so good.
No, you're worried that
But
it's going to get kicked
But
back.
we're getting there.
But Lindsay's been doing a great job with this, and unfortunately learning the bureaucracy like I've had to over the last couple of years. Now she's learning it also.
Right.
So.
Is that it?
Yes, no, fortunately, nothing else new happening. It's unusual.
Okay, quickly, my apologies for missing the meeting last week. It's the first one I've missed in more than 2 years. Did not want to miss it, but things have happened. Yeah, exactly. I did the same thing to myself in the mirror.
You're fine.
Yeah, I missed one and I apologize for that. If you haven't noticed our waiting room, you should go look at it.
Okay.
It looks very different than it has. It's been.
Beyond the new door?
It's much nicer. It's much
Okay.
more secure. It's much more customer service oriented. Which I think is the real goal ultimately, is it makes it much easier. They don't have to move through the office. They can go right to a front desk with someone on the environmental side and someone on the clinical side that can assist them immediately.
Thanks.
So that's beautiful. And if there's no one there, you can ring the bell and someone will come help you. So not the way it was before. We're going to do that with the clinic rooms to clean those up, get them modernized. Get them updated a little bit, and that'll be nice. If you haven't been in the clinic rooms, they have very nice 1980s steel cabinets with really cheap formica, and that will be gone. So we'll be moving beyond that. Other than that, I don't have too much else to say. Financially, we're doing quite well, and the October report will show an even greater improvement to the September report, to the preliminary September report. So we're doing pretty well there too. It's just making sure we're billing the grants on time, getting reimbursements and things like that, and doing it properly. So
Perfect.
nothing else. The next one's really important though on the agenda.
Yes, any questions on any of the reports before we proceed?
If you're on to the next issue, I'll make a motion to reschedule November for the 17th.
Okay, I don't, do we need a motion? Cause
You know, it's automatic,
on our
it's automatic,
bylaws.
it's just whether or not you're comfortable with it being that
So
next
think-
Friday,
Thinking ahead also to the December,
right?
Yeah,
to, whether we
yeah, so
are we planning that.
whether we do a December meeting, because if you don't have a lot of business, do we want to cancel the December meeting? And resume in January?
Well, because it's the holiday season and he's probably gonna be doing their Christmas shopping, yeah.
Because I think it's a little later in December, right? Like
It
the
is.
second week is like the 16th or something,
Yeah,
or the second Friday.
it's like, yeah,
It
it's,
looks like the second Friday is the 8th of
so
December.
it's actually early.
Oh, it's the 8th. I'm actually.
It's like right after Thanksgiving.
Yeah,
Yeah, and I'm actually on work travel now.
It's like, you guys can hash that out. It automatically sets to the 17th that Friday, according to bylaws. So November 17th will be the next.
Right, that's for the November one.
Right,
So November 17th, but then, okay, I see, and then we just have basically a quick turnaround. So, so the 17th, the bylaws kind of dictate it. So unless there's anybody that wants to change it.
Right.
We can stick with November 17. But then the question, and if you'd like to make a motion on this, is that if we forego the December meeting. So just people can plan accordingly.
Sure, I'll make that.
Okay, I'll second it. And just for those on the call, we're talking about, so our bylaws automatically get us to. We have to move our meeting to November 17 because observed Veterans Day is when our normal meeting schedule would be. But then we're also voting because of the now shortened time frame of between the November and December meeting is just foregoing the December meeting and then reconvening in January. So the motion on the floor is to forego the December meeting. Motion is by Elliot, seconded by myself. Any questions about that before we call for a vote?
Just, if something should come up in December that we need a special meeting, we can call
do
that and have it
Ex-
online and for
Exactly.
the one topic.
Exactly. All
No
right, all-
questions here. That's very clear.
okay, thank you, Brandon. All right, all those in favor.
No
say-
question.
Thank you, ma'am. All those in favor say aye.
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 All right, wonderful.
I have one other thing before we adjourn, I forgot, the state is, Bureau of Public Health is doing a needs assessment, and so we can. Send that to each of the board members, I think we have it on our website, or we will.
Yep.
Also, next Thursday, they're having what they call. Regional listening, where they can come and hear public comment, and they have this, decided to do that in different regions, and for our region, they have, it's next Thursday and it's in Kaiser. 2 hours from here.
I love you some coffee.
But it's, so if anyone wants to come to that,
Kaiser roll,
yeah, so, yeah,
sorry.
so it's,
Oh, different.
and the reason for that is they had so our region includes 8 counties, 9 counties.
9 counties.
And,
Right, yeah.
the sanitarian in Kaiser in Mineral County is the one who's the head of our threat preparedness region, so he's having it at his thing.
Gotcha.
Not quite the population center. but-
Right.
Their health department's really nice.
Sure is.
It's super nice.
All right,
We'll send you that invite.
thank you.
The trees will be pretty.
Sure, absolutely. All right, is there a motion to adjourn?
I so move.
Second.
Thank you. All those in favor say aye. Aye.
Aye.
Aye.
All right, thank you, everybody, and
Thank you. Have a good day.
Thank you all.